welcome. My name is Sarah Grace Pansarak, and today I'm going to do a video of a full head-to-toe examination for advanced health assessment through Maryville University with Professor Brandy Stiles. So I'm going to ask my patient to come in, greet them. Hi, how are you?
Hi, how are you?
Good. You can have a seat here. Before the patient enters the room, I would ask them to empty their bladder. I would also notice how the patient's walking in. He had a normal gait. He's well groomed. Next, I'm going to inspect his head. So I'm going to look at his head, and I notice it's symmetrical, and so he has normal cephalic. Also, his inner canvas is in line with the auricle of his ear. I'm going to palpate his scalp, and his hair is non-coarse. I'm also going to palpate his maxillary sinuses and his frontal sinuses, noticing anything tender or swollen. I'm also going to have him puff your cheeks out for me. Okay, so we know that cranial nerve 7 is intact. I'm also going to palpate his jaw. Can you open and close your mouth for me? And noticing if any presence of TMJ. I'm also going to apply a cotton ball to his face and ask him if he feels it evenly on both sides of his face. Do you feel that evenly on both sides?
Yes.
So we know that cranial nerve 5 is intact. The next thing I'm going to do is look at my patient's eyes. I'm noticing that his sclera is white. I don't notice any exudate. His conjunctiva is pink and moist, which is normal. I'm also going to, at this point, we would also check his vision using the Snellen chart for distance and the Rosenbaum chart for near vision, and we found that his vision is 20/20. I'm also going to use my ophthalmoscope to check the red light reflex. And it is normal in both eyes. And also, we check his eyes are pearl, his pupils are equal, reactive to light and accommodation. I'm also going to check the 6-point field gaze. Just follow my finger. And that's normal, and no strabismus was noted. And I'm just going to cover his, do the cover and uncover test for his eyes. And no strabismus was noted, or no nystagmus was noted for the 6 visual field point gaze. Next, I'm going to look at his ears. His ears are symmetrical. I don't notice any drainage or any exudate coming out of the ear canal. I'm going to do the whisper test to check his hearing on both sides. I'm going to whisper one number in one ear and another number in the other ear, and he'll have to repeat it back to me.
2. 1.
And that is normal. Next, I'm going to use my tuning fork and do the Weber test and Rhine test. The Weber test, I'm going to place the tuning fork midline on his scalp, and he should hear the noise of the tuning fork equally on both ears. Do you hear it equally on both ears?
Yes.
So that is a normal Weber test. Next, I'm going to do the Rhine test, where bone conduction should be twice as long as air conduction on both sides. And tell me when you stop hearing or stop feeling that.
No.
And then tell me when you stop hearing it.
No.
normal, and I'm going to do it on the other side.
Now.
Okay.
Now.
And that is a normal brain test. So we know that cranial nerve number 8 is intact. Now I'm going to look inside his ears and look at his eardrum with my my otoscope. And you pull up and back, and we can see his tympanic membrane is a pearly gray and it is tacked, no bulging or swelling. There's some earwax, which is noted, which is normal. But I can visualize both tympanic membranes are pearly gray and intact, no bulging. Next, I'm going to look at my patient's nose. It is midline on his face. I'm going to occlude each nair to check for patency of each nair. So just breathe in and out. And then the other one. So both nasal passages are patent. I'm also going to look inside the nose just to make sure that they're it is pink and moist. I don't see any swelling or anything. I'm going to test his smell and see if cranial nerve 1 is intact. Tell me what you smell.
Alcohol.
Yes. So we know that cranial nerve number 1 is intact. Next I'm going to look at his mouth, and I notice his lips are pink and supple. There's no cracks or any sores or anything that I know on the outside of his mouth. When I look in his mouth, I'm going to look at his teeth. His teeth appear white. I see 28 intact adult teeth, no cavities or anything like that. Also say ah. The uvula rises. I can see that the soft and hard palate are both intact. His tonsils are +1. And I'm going to have you stick out the tongue, move it side to side, and then we would test his gag reflex, and that would be normal. So cranial nerves 9, 10, and 12 are intact. Next, I'm going to look at his neck. I'm going to assess the patient's neck. And it looks normal. I don't see any lesions or bumps or anything on his neck. I'm going to assess his thyroid as well. I can see that his trachea is midline. I'm going to stand behind the patient and ask him to swallow. And I notice the thyroid is no mass is present. There's no masses, no goiters present. I'm going to also assess the lymph nodes. I'm going to look at assess the periauricle, postauricle, ocular, tonsillar, submandibular, superficial cervical, posterior cervical, and supraventricular and axillary. So I would be assessing his lymph nodes. Armpit. And I did not feel any lymph nodes present. I'm also would have assess the carotid pulse, look for any jugular vein distension on either side, listen with the bell of my stethoscope for any bruise, and that's fine. His carotid pulse is +2, which is normal. I'm also looking at his upper extremities. I'm going to have you shrug your shoulders for me. So, good. And that means cranial nerve 11 is intact. He's able to shrug his shoulders. Then I'm going to also look at his hands. Look at his fingernails. There's no clubbing. He's got +2 capillary refills, which is normal. No clubbing or anything on his fingers. And I would also check his brachial pulse and his radial pulse, and they were both +2 and equal on either side. Next, I'm going to look at his back. Just look this up. I'm looking at the patient's back. It's symmetrical. I don't see any. I see some nevi there, but they all look normal. I'm going to be palpating for tactile firmness. I'm going to have the patient say 99 when I tap his back.
99, 99, 99, 99, 99.
And then I'm going to check his chest expansion. So I'm going to place my hands on the patient's back and have him breathe in and out. And I'm noticing chest rise and fall equal on both sides. I'm also, then I would look at his curvature of his spine. It is equal. I don't notice any scoliosis or anything like that. No tenderness on his back. At this point, I would also measure diaphragmatic excursion. I would have him take a deep breath and hold it. And then I would tap him up, marking down, and diaphragmatic with my measuring tape. I would measure, it should be 3 to 5 centimeters. I would also percuss his back. And then I'm also going to listen to his his lungs, going left to right. And I hear normal vesicular breath sounds. I don't hear any crackles, rails, or wheezing. Then I would ask my patient to lay down. Yeah, on your back. Just gonna look at your chest. I'm going to look at the patient's chest. Look at his breathing. I would also, palpate his chest. I would go to the 5th intercostal space. I'm going to listen to his apical pulse. I would percuss the chest for great, and also I'm going to listen to all the 5 heart sounds, which are the aortic, pulmonary, Erb's point, tricuspid, and mitral valve areas. I'll just go through your shirt because I know you don't want your shirt like that. S1 and S2 are noted. No abnormal heart sounds or murmurs have been heard. Next, I'm going to assess the patient's abdomen. I'm going to percuss the abdomen, and you should hear dullness over solid organs like the liver, and tympany over gas-filled organs like the stomach. I'm also going to measure the liver size, which should be 6 to 12 centimeters. Feel for the spleen and check for any aortic pulsations. Feel for any aortic pulsations and try to capture a kidney. You can't capture a kidney on either side. Next, I'm going to have my patient sit in the chair again. And we're going to test sharp versus dull sensation. So just close your eyes for me, and you're going to have to tell me if if the sharp side or the dull side of the pencil is touching you. Okay?
Sharp side. Dull side.
Mm-hmm.
Sharp side.
I guess open your eyes.
Dull side.
Mm-hmm.
Sharp side. Dull side.
No. So we know that all 12 cranial nerves of the patient is intact. Next, I'm going to check his pedal and popliteal pulses. Sorry. Let me check his pedal pulses on his legs. +2, normal. The patient has good muscle tone. I'm going to check his deep tendon reflexes. With my reflex hammer. And I'm going to check the brachial, the knee, and the Achilles reflexes. Okay. Okay, and could you also like move your arms, your range of adjusting your range of motion and your legs, and just move your legs up and down. And range of motion is intact. And there you have it. That is our